Welcome everyone. Please give me a thumbs up or type it in the chat box if you can hear me so I know if my audio is working properly. Okay. Thank you for joining the Dental and Vision for Active Employees webinar. We have our representatives from VSP, Delta Dental, and United Healthcare Dental, and our very own SFHSS joining us today, who will be happy to answer your questions through the Q&A comments box. Your microphones will be muted during the entire webinar, but we encourage you to ask questions through the Q&A box in your menu bar. The presentation has been pre-recorded to allow our representatives to focus on answering your questions. At the end of the presentation, you'll be able to hear our representatives and see them in the cameras to answer the questions from the Q&A box. And with that, let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF My Hub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF My Hub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Here's how your Delta Dental plans will help you shine. Released in 2000, the first ever Surgeon General report on oral health emphasized the importance of oral health to overall wellness. The terms oral health and general health should not be interpreted as separate entities. Oral health is integral to general health. Oral health means more than healthy teeth, and you cannot be healthy without oral health. We now know that the mouth serves as a mirror, showing us information about other parts of our body like systemic disease and cancer. This visual shows all the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. There are plan features that are here to assist with maintaining good oral health. On the DHMO plan, low to no cost copayments. On the PPO plan, diagnostic and preventive maximum waiver and SmileWay benefits that we will highlight in the presentation. Now let's take some time to go over your plan options. Let's go over the DeltaCare USA plan first. The DeltaCare USA plan offers many advantages, including most covered services at a no cost or low cost copayment to the member, no annual maximum, no deductible, no claim forms to fill out, predictable costs as your benefits guide shows all covered services and what your copayment is for those services. Getting started with DeltaCare USA is easy. Go online to look up DeltaCare USA providers. Then visit any DeltaCare USA general dentist that is accepting new patients. When your dentist files a qualifying claim, you will be added to their roster and they will become your assigned DeltaCare USA dentist for any future appointments. You must visit this dentist for future visits to receive benefits. You can change your general dentist by contacting Delta Dental by phone or through your online account. Provider changes made between the 1st and 15th of the month are effective immediately. Provider changes made on or after the 16th of the month are effective the 1st of the following month. When you visit the dentist, you don't need to bring an ID card to receive treatment. Just provide the dental office with your name, social security number or enrollee ID, and your date of birth. Your dentist will work directly with us to complete any necessary paperwork, so you don't need to worry about any claim forms. Just pay your copayment if you have one at the time of treatment. Read your plan booklet to learn more about covered procedures and copayment amounts. Specialty care is available with a referral from your primary care dentist. For out-of-area emergency care, if you need urgent care and are away from your primary care dentist, DeltaCare USA provides a limited allowance for care. A few details to keep in mind. You will be required to pay for treatment and request reimbursement. Refer to your plan booklet for specific coverage details and procedures. Let's take a quick look at some of the covered services and copayments. As you can see, there are no deductibles to meet and no annual maximum. We have highlighted some of the more common dental procedures and their copayments. Here is a look at the orthodontic coverage for children and adults, which includes all phases of ortho treatment, pre and post records, tooth extractions, and coverage for ortho progress in treatment. It also shows you the startup fee. Now let's take some time to get to know your Delta Dental PPO plan. Maximize your savings with a PPO dentist. Get the most value from the PPO plan by choosing a Delta Dental PPO dentist. You do have the flexibility to see any licensed dentist. You can visit any licensed dentist and receive coverage. You won't be charged more than your expected share. PPO network dentists agree to set fees. This means you won't be balance billed. You won't be charged more than your expected part of the bill. Here's a snapshot of your PPO benefits. You have no deductible. Annual maximum is $2,500 per person each calendar year, with diagnostic and preventive services waived towards the maximum. You can see there are 3 columns, all with different percentages shown. The percentage column on the benefit sheet is the percentage that Delta will pay when a claim is incurred. As you can see, the percentage is highest when you use a PPO in-network dentist. We do encourage you to use a PPO provider as they discount their fees the most. It is slightly lower when you use a premier dentist. When you stay in network and visit one of these dentists, you won't get charged more than your expected share of the bill. Using a non-Delta dentist or an out-of-network dentist may result in balance billing and higher out-of-pocket costs. Orthodontics are covered on this plan for both children and adults. Coverage is 50% up to a certain maximum, which varies by network. Staying in the PPO network, the maximum is $2,500, using a premier provider, the max is $2,000, and using a non-Delta dentist, the ortho max is $1,500. These orthodontic maximums are lifetime, meaning they do not reset annually like the annual maximum. Also covered is nitrous oxide and non-IV sedation on the PPO plan. You can save money with the diagnostic and preventive maximum waiver. Cleanings, x-rays, and exams fall under this category. When receiving those services, they are waived from your annual maximum, saving your benefit dollars. This slide is an example. If you went to the dentist and had an oral exam, x-rays, and cleaning, and the treatment cost was $350, with the diagnostic and preventive maximum waiver, your annual maximum does not go down to $2,150. It is still $2,500 for the year to be used on other services. Your plan includes the SmileWay Wellness benefit, which offers enhanced coverage for higher risk enrollees. The health of teeth and gums is tied to overall wellness. Gum disease and tooth decay are associated with a number of systemic conditions, and enrollees with certain medical chronic conditions may benefit from additional teeth and gum cleanings. Delta Dental PPO enrollees can take advantage of expanded coverage if they've been diagnosed with the conditions listed on this slide. Members can self-report via their online account, and it's entirely confidential. To summarize, let's take a quick look at the differences between the PPO plan and the DeltaCare DHMO plan. In choosing a dentist, PPO plan, you can visit any licensed dentist, but we do encourage you to use a PPO provider for greater savings. DeltaCare USA plan, you do have to seek services from your primary care dentist. The PPO plan has an annual maximum, where the diagnostic and preventive services do not count towards that maximum. On the DeltaCare USA plan, there is no annual maximum or deductibles. On the PPO plan, covered services are paid at a percentage. Delta pays a percentage of the services, member pays a percentage. On the HMO plan, all of the covered services have preset payments, which are low cost or no cost. On the PPO plan, there is no referral needed to visit a specialist. On the DeltaCare USA plan, you do have to go through your primary care provider to coordinate coverage for a specialist. And for the PPO plan, the dentist will file a claim form for you if they are in network. If they're out of network, you may have to submit the claim. And on the DeltaCare USA HMO plan, there are generally no claim forms to file. We do encourage you to visit your customized website, deltadentalins.com/CCSF, for a myriad of things you can do. Our website has a wealth of information that you can access without logging in. Search for a nearby dentist in your plan's network. Be sure to choose your plan in the drop-down menu, either PPO or DeltaCare USA for the DHMO plan. You can find answers to common questions about dental care and managing costs in our enrollee support guide. Find extensive dental health and wellness information on our website. And you can also sign up for GRIN, which is our free dental health magazine that would come to your email inbox quarterly. While you don't need an ID card, if you do want one, you can log in and print your own. As a Delta Dental member, you are eligible for these member perks. Virtual dentistry, which is a video-based platform that allows you to speak with a dentist live on your phone or device. Brush Smart is a discount program on Philips and Oral-B oral healthcare products. You can also get discounts on hearing aids through Amplifon and LASIK through QualSight. Life Perks, which gives you instant access to offers from a rotating group of merchants. You'll also receive emails that let you know about the newest discounts. And wellness resources, which include online articles, recipes, videos, and more. Scan the QR code for instant access or use the URL listed here. We do invite you to socialize with us on our social media sites where we offer up-to-date dental information and wellness tips.
Welcome. My name is Monica Andrade, and today I will be discussing your dental plan options through United Healthcare. Your employer offers two different plans and a range of services from routine checkups, cleanings, to advanced procedures, ensuring you receive the best care possible. With flexible options and affordable rates, maintaining your dental health has never been easier. With the direct compensation dental plan, you have the freedom to see any dentist in our statewide network without having to choose a primary care dentist in advance. Of course, a primary care dentist can be helpful guiding in managing your oral health. So you may want to choose one anyway, or see if your regular dentist is in the network and that there is one near you in your preferred area. If you need to see a network specialist, you'll just need a referral from your dentist or contacting United Healthcare Customer Service Department. The plan is designed to fit your life in other ways too. You have no deductibles or annual spending limits, just a fixed copay for covered services and treatments. Coverage for hundreds of different dental services like crowns, braces, and silver fillings. Plus, we also have oral cancer screenings for adults 18 and older, and extra dental visits during pregnancy and the first 3 months after giving birth. Finally, preventative care is most often covered at 100% in the network with a zero copay. The oral cancer screenings just mentioned, for instance, are covered as well as preventative care. Remember that if you decide to see a dentist who's not in our network, it won't be covered by your plan, so it's a good idea to stay in the network. Who's eligible? Employees and retirees, along with their eligible dependents that would include their spouse, domestic partner, and children up to the age of 26. It's easy to let regular dental exams slip through the cracks when life gets busy, but they're crucial for maintaining your overall health. Explore your dental care options to find the best fit for you. Embrace retirement with a confident smile and discover what you've been missing. Prioritize your dental health by learning about your options so you can keep your smile bright and your life healthy. Good oral health may be linked to reducing the costs and complications of many high risk, costly conditions such as diabetes, heart, and kidney disease. Our whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. For example, have you been able to get the appropriate periodontal and preventative care for your condition? We can help you identify closing those dental care gaps that may help you achieve better health and save money. Now we would like to discuss condition-specific data. Diabetes. People with diabetes are more likely to have gum disease. If left untreated, this can make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease. Pregnancy. Gum disease in pregnant women may be linked to complications such as preterm birth and low birth weight. Asthma. Employees taking asthma medication may be at risk of cavities, dental erosion, and periodontal diseases. Kidney disease. Treating gum diseases helps reduce inflammation, which can help reduce the risk of kidney failure. COPD. Periodontal disease may increase the risk for respiratory disease. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 90% of targeted employees were successfully reached by phone and/or mail. Preventative care includes wellness benefits covered at 100% in the network, 2 routine checkups every year, extra cleanings and treatments for expectant mothers, annual oral cancer screenings for covered adults ages 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Our dental activation combines medical and dental data to help identify at-risk employees and assess whether they're getting dental care to manage their condition. The timely interventions also encourage employees to seek oral health care. Although many services are at no cost to you, there are some services with a copay cost. Please remember to refer to your plan summary for additional information. MyUHC.com helps make it convenient for employees to learn about and maximize their benefits. The updated look and feel to create an experience that is simpler to navigate and understand. Improve usability of content and visuals by focusing on plain language standards and clearly presented information and prioritize actions. We have common navigation, look and feel across all digital assets that includes our websites and our app. With myuhc.com, employees can find a dentist, which makes it easier to locate a network provider who is nearby. You can also get health and wellness information to learn how oral health impacts overall health. Manage your claims. You can view claim history and pay a provider. Look up your benefits. See what's covered by your plan. Easy to access and print your ID cards, which is a convenient way to show proof of coverage. Use a calculator. The cost calculator will help you find what your plan pays for a procedure and what you as the employee will have to pay, and also compare local provider fees. Once you're enrolled, you'll find information and easy-to-use tools on your member website at myuhc.com and in the United Healthcare app. Together, they make it easier to get the most from your dental plan. You can find a network provider near you to go through your dental plan details, review your claims, and find answers to common dental questions. You can also download and print an ID card. With your United Healthcare plan, keeping up a dental visit is designed to be easier. Simply show your ID card when you visit your dentist. You'll be taking advantage of special network rates. Then, when you're at your visit, you'll only pay the office visit copay along with a specific copay for each covered service. Those copays will depend on your plan design. Finally, once you've had your procedure, you're all done and your claim will be submitted for you. A few points to remember. Our network provides access to board-certified dentists, ensuring top quality care without the hassle of deductibles, annual maximums, or waiting periods. You won't need to fill out claim forms for covered services, making your experience seamless. Enjoy low, predictable dental costs while benefiting from good oral health, which may help reduce the costs and complications of high-risk conditions like diabetes, heart disease, and kidney disease. We address individual needs with a whole person approach, focusing on preventative care and at-risk outreach. Our coverage is network only, ensuring you receive care from the best providers. For additional benefit information, don't forget you can also log into your yuhc.com /SFHSS website. Your 2025 benefit information will be uploaded into the portal for easy access. Additional information found on the website, remember, will be searching for a provider, digital tools to access estimated costs, your health plan ID card, and view balances with claim details. We also have wellness resources that provides free program and activities in physical health, healthy eating, stress management, and flu prevention. Ready to enroll? Review your plan materials and take the opportunity in today's session to ask benefit information that may be helpful in choosing the best option for you and your family. Thank you for allowing United Healthcare to be your trusted healthcare partner.
Hi, I'm Morgan, and I want to thank you for taking the time to learn more about your benefit offering through VSP Vision Care. At VSP, our goal is to help you see well and be well for a lifetime of good vision. Let's take a look at the great vision benefits available to you. How does VSP help you prioritize your health and your budget? First, vision care is essential. Signs of over 270 health conditions can be detected during an eye exam, so it's important it's on your wellness checklist. You get savings that really stack up. Great everyday savings on eye care and eyewear, plus loads of extras so you can save all year long. You can choose high-quality care from our huge network of private practice and retail chain locations. Plus, you can shop online on Iconic. Founded by doctors focused on you, your well-being is at the core of everything we do. On the last slide, we mentioned that vision care is essential. Why is that? It's the only non-invasive way to view your blood vessels. That's how your eye doctor can detect over 270 health conditions during an eye exam. And in some cases, an eye doctor can be the first to detect signs of certain conditions, like diabetes. Even if you don't wear glasses now, your vision can change from year to year. We all deserve healthy eyes. Prioritize you and your family's eye health and wellness, and enroll in vision coverage today. Retinal screening is a quick scan that shows images of the inside of the eye. It can be used to detect eye disease and conditions as a baseline of a healthy eye. Compare year after year to detect even subtle changes. With your VSP coverage, you get a retinal screening each year for a minimal copay, and members with diabetes receive a retinal screening fully covered each year. Your plan already covers the essentials, but if you want even more savings and enhanced coverage options, upgrade your plan during open enrollment. Here's a snapshot of your plan options. With VSP Light Care, it's easy to defend your eyes from the sun's ultraviolet rays or from blue light from screens. And you don't even need a prescription. Simply visit your VSP network doctor and choose ready-made blue light filtering glasses or sunglasses. This is an especially good option for parents with children who don't need corrective lenses. With essential medical eye care, here's what's covered. Fully covered retinal screening for members with diabetes who do not have diabetic eye disease. Exams and services to treat immediate issues like pink eye and sudden changes in vision. Treatment options to monitor ongoing conditions such as dry eye, diabetic eye disease, glaucoma, and more. This coverage is supplementary, and in most cases, your health insurance will be billed first. You may be able to coordinate with your VSP benefits in order to help reduce out-of-pocket costs. If your VSP doctor doesn't participate with your medical insurance plan, VSP has you covered with only the cost of your copay. Your plan also covers computer vision care, which includes a yearly computer vision exam to evaluate your needs for computer use. Computer vision care benefit is only available for the subscriber, employee. With VSP, you have access to benefits that you can use at private practice doctors, retail stores, and online. With thousands of locations, getting the most out of your benefits is easy with a Premier Edge provider, including private practice doctors, VisionWorks, and iMart Express retail locations nationwide. Your benefits go further when you visit a Premier Edge location with access to exclusive rebates and offers such as Premier Edge Promise, a worry-free eyewear guarantee, exclusive offers and savings, and advanced exam technology including digital retinal imaging and more. And if you prefer to shop online, Iconic is the in-network online eyewear store for VSP members. You can choose from over 60 eyewear brands and over 1,600 styles. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information, and we'll take care of the rest. We understand that choosing a doctor is a personal decision, so we've made it easy to find the right care for you. Simply navigate to find a doctor on VSP.com. Enter the preferences that are meaningful to you. You can even use the slider to search by distance and view your choice on a map so it's easy to see how quickly you can get to each location. You've seen the everyday savings has built your VSP plan. Now let's take a look at ways you can stack your savings. 50% off additional pairs of glasses and sunglasses at VisionWorks. Prefer to shop online? VSP members save an average of $250 at Iconic, plus free shipping and returns. How about an extra $20 to save on featured frame brands? Plus, VSP members have access to exclusive member extras, like 60% off a pair of hearing aids from True Hearing and so much more. Like vision loss, hearing loss can have a huge impact on your quality of life. As a VSP member, you have access to savings on hearing aids through VSP's partnership with True Hearing. Visit truehearing.com/VSP to learn more. We also get you're busy, so we've put everything you need in one place. Your personalized dashboard on VSP.com. Before your doctor visit, view your benefit and check out special offers. After, you can view your claim and even download your vision savings statement to see how much you saved. You can even take a diabetes risk assessment. And it's easy to toggle back and forth between family members with the Switch Member feature next to your name. Get the coverage you need and save hundreds on glasses, contacts, and more. Vision insurance is worth it. See what it can do for you.
All right, we will now begin our Q&A session. For some reason, my camera is not working. Try that again. There it is. I'd like to ask our representatives to turn on their cameras and answer the questions our members have been sending in the Q&A box. Some have already been answered. I want to remind our members that you can still send us your questions by typing them in the Q&A box. Look for the Q&A box in the menu on the top or the bottom of your screen. Please do not share personal medical information as everyone will be able to see it. We'll be ending this webinar promptly at the end of the hour, and we will allow our representatives to answer to support other members as well. So we'll be respectful of everyone's time. We'll have a last call for the question 5 minutes before it ends. And with that, let's see, let me go back to the very first question here from May. I won't be able to stay for the entire webinar if I join VSP Premier. When does the calendar year start for allowance? Thank you. And Isabel, if you could just re-answer that question for us so it can be recorded in our webinar there.
Sure thing.
Thank you.
Sure thing. Sorry about that.
No
Yes,
worries.
so coverage would begin January 1st, 2026.
Great, thank you. There's a couple of questions that are very similar. One is from Andrew. If you can get a transcript of this webinar. This webinar is being recorded and will be available by tomorrow. I dropped the link there, but I also dropped the link several times within the Q&A box of a similar webinar video that was recorded. So if you still don't see it, please go ahead and re-request it, but it's on there a couple of times. There's a link of a similar webinar video. From King, does Delta Dental has international coverage in case there is a need for procedures during travel? And Carrie, if you can answer that question for us.
Sure. Yes, you have emergency coverage, actually worldwide. If you're on the PPO, you actually can go out of the country and have services performed at will. Usually in Southern California, I always mention that closer to San Diego, we have a lot of employees that will go over to Mexico, and they have their dentists and everything there that they see routinely. And if they are on the PPO, then those services are covered according to their plan. They just have to bring back, you have to pay up front, and then you bring back a narrative of what was done, what teeth were treated, and what exactly was done, along with an invoice that it's been paid. And then there's a claim form on deltadentalins.com that you can file and submit those expenses and we will reimburse you. But as far as either plan, either the PPO or the Delta Care USA, they both have emergency coverage. I think probably the PPO is covered a little better because it's just easier to use, and we don't have HMO facilities outside of the country. But you could still have emergency care, and we will reimburse you for that on both plans.
Great, thank you, Carrie. Another question here is from Iwana. Why PPO Delta plan does not cover filling for the same tooth in less than 2 years? And I think you mentioned there is a customer service phone number that is available, and I'm trying to look for it here. Do you happen to have that, Carrie, by any
You know
chance?
what? It's I'll tell you where it is here. Okay, the customer service number is 888 335
335
8227, and I can put it in the
27 888 335 8227.
yes.
And that is the customer service.
Right. And the reason I want to mention the reason that I said that was because we're not sure what is happening with that tooth. Like, why would it need a filling in less than 2 years? Why would a filling have to be redone in that short period of time? There might be something else wrong with the tooth. So that's not just a cut and dried response. That would be, maybe it needs a root canal, or maybe it broke, or maybe it could be any number of things. And that's why I said customer service is the best bet.
Great, yeah, it's needed more specific question type of session there. Thank you. And another one for you, Carrie. Just to confirm, can we see a Delta Dental Premier Dentist if we have Delta Dental PPO?
Yes, you can. Premier is kind of a second tier of our providers, and it's not a different plan at all. It's just a different network. So if you go to the PPO network to try and find a dentist and you can't find who you're looking for, maybe you have a name or a referral and it's not there, then you certainly have the option to back out, click on Premier, the Premier plan. It's in the list of the different plans, and that will take you to the Premier directory. And the Premier directory dentists get paid a little bit more as far as their discounts. Their discounts aren't as steep as the PPO, so you have a little bit more out-of-pocket expense. But you can certainly use those dentists if you can't find a PPO dentist, or if you just don't need to because your dentist is on the Premier network anyway. You can utilize that network. And just remember that the fees are going to be a little bit higher for you.
Thank you, Carrie. Another
Mhm.
question there regarding this recorded video. Again, if you can't still see it on one of the links that we've pasted on there, please let us know. And a question from AJ is asking where the premium rates for these plans are. And again, both Sonali from SFHSS and I have dropped the link for the rates for those plans. And for the dental rates, they're on page 16 or 17, depending on how you're looking at the page numbers there. But it's in that digital guide. From Erica, a question. The non-delta coverage percentage could be, this is like a long one, can be misleading. So Carrie, I don't know if you can follow this one. It is
Sure.
not 60% or 80% of what it costs. It is the percentage of a negotiated rate, which is not listed. You need a CBT code and is very little. It's a little bit misleading that I took on the face value last year, and members should know. Example, non-dental dentist PPO will reimburse 80% of the $20, so it's $16 for fluoride, no matter what you are actually charged. As you can imagine, no dentist charges $20 for fluoride. I took my child to a pediatric dentist that charged me over 100, and I was reimbursed $16, not 80%. Just flagging for the members to know and understand what the coverage for our out-of-network dentist actually is. Please confirm that the list of the percent for out-of-network is a percentage of a flat negotiated rate and not actually a percent of what you are charged, like the one pager implies. I believe they're referring to the guide or maybe a cheat sheet from Delta Dental. I'm not sure. I'm not sure if you follow that, Carrie, or it's just maybe something that needs
Well,
to be with customer service as well. Yeah.
yeah, I'm not exactly sure which plan they're on,
Mhm.
because this person is discussing a flat negotiated rate. And on the PPO plans, we don't have a flat negotiated rate. You do pay a percentage, but I answered the way that I thought they were headed, which is that if you are using your PPO, if you're on the PPO, which I thought they were, so I'm not sure. If you're on the PPO, that's always going to be your best value as far as the least amount of out-of-pocket expense, because the PPO dentists discount their fees more for Delta, which is passed on to you. Then if you have a need to move to the Premier Network, which maybe you do if you can't find your dentist, or you know of a dentist that's on the Premier Network, keep in mind that the Premier Network, what you see there is you see a little bit lower percentages that we pay. So you'll see 80% on that, as well as like a $2,000 ortho maximum. So you pay a little more out of pocket if you're going to go to the Premier Network with the Premier Dentist. So that's your second best value. Then I think what they were talking about was out of network completely. Again, I'm sort of guessing, but the out of network completely. If you go out of network completely, you do not have any control over what that dentist is charging you. We don't have any control. Basically, what we've got is they can charge anything that they want. And so what we do is we actually pay them a lower percentage of what our allowable amount is, but they will balance bill you the difference of what they actually charge and how much we give them. And you'll end up paying a lot more out of pocket if you go out of network completely. So this is a way that we keep encouraging our members to try and stay in network. It's just to your advantage, and our in-network Premier and PPO plans have thousands and thousands of providers that are on them. So I'm not exactly sure if that's where you were going. I can't answer why you were charged $16 for fluoride, because I don't know why. But it's on the PPO is not a flat fee. But if you're on the DHMO, you may have a flat fee for fluoride. You'd have to check in our booklet that we have online for you.
Yeah, and again, the customer service phone number is at 888-335-8227. And that also goes for the next question, because they wanted to re-ask again, why this PPO Delta plan does not cover filling for the same tooth in the less than 2 years. And I think, Carrie, you answered that as well before, right? Because I think you were asking why it needs to be the same tooth refilled within the 2 years. Anyhow, I guess you would refer them to the.
That's on a case by case basis, because we don't know. We don't know just by having a question like that what is wrong with that tooth. There might be something else wrong with it. Maybe it broke, or needs a root canal or something like that, and that's why they would need to do a filling in less than 2 years. I don't know. That's why customer service would have any claim information that they could give you and look up.
Thank you.
Mhm.
And I don't, oh, let's see. Okay, one for VSP. Please explain if VSP is also the same as iconic or different. Isabel, if you could re-ask, yes, please. Thank
Yes,
you.
of course, of course. So yes, VSP owns Iconic, and you can apply your vision insurance on Iconic. I put the website on there. It's just www.iconic.com. And then when you go to the site, you would go to Use My Insurance to link your benefits.
Yeah, thank you. And I'm just going to spell that because they won't be able to see the actual chat typed on there. They're only going to hear the recording. It's www.iconic, so EYE, like the I, and iconic, CONIC.com. And you go to Use My Insurance when you visit the site. Thanks, Isabel. Another one from VSP. I see that VSP Basic is included with medical premium. It is included for all the members of the family that are covered by a medical plan under CCSF. And our very own Sonali, if you can re-answer that question, please.
Sure, thank you, Jay.
Yeah.
It is correct. VSP Basic is bundled with our medical. When you enroll in medical, you and your dependents are enrolled into the VSP Basic by default.
Thank you. And the next one is for VSP again. For VSP, does the benefit covers international provider? Say if I need to replace my glasses in travel or sunglasses that I like during the travel. That's a good question, actually. Isabel, yeah, if you can answer that, please.
Yes, so you can go outside, and it would just be considered an out-of-network provider. And to be reimbursed, you can either complete an out-of-network reimbursement form and then mail it in along with a copy of your receipt. Or for easier access, you could go on VSP.com, and once you're logged in, you can start the process there and upload your receipt.
Great, thank you. Let's see if I see any new ones come in. Um, Yeah, the next question, I don't know if we can answer this one, but I'm just going to read it off anyway. From Andrew, why are so many dentists are becoming out of network for Delta Dental? A dentist used to be in the network, but is not anymore because he was not being compensated enough by Delta Dental. It now costs a lot more money to go to the dentist. I'm not sure if we can answer this one. If you want to share something
Well,
with
I
them, Carrie.
think there's a couple of things that could be going on. First of all, I'm not sure where this person lives, but I know that in one of our meetings, we were talking to people that were like up in Humboldt County or in areas that were very, very difficult to recruit dentists in. And we're always recruiting dentists. So it's not for lack of us not being out there in the mix trying to replace those dentists that do drop. My personal opinion, and of course, I don't know every situation, but my personal opinion is that we are still suffering from the pandemic as far as during the pandemic, there were so many dentists that literally had to close their practices down or they weren't really making a living because they couldn't see patients. And here we are a few years down the road, and I really do believe that they are still trying to make up for the losses that they took during the pandemic. And so what they're doing is it's not just Delta, by the way, I want to mention that. It's like all of the dental carriers are having the same problem. That's why I think that it's because they don't want to discount their fees, because they had to take such a hit, for that period of time. And so they're like, we don't want to discount our fees anymore, so we're going to drop these particular programs. So that's kind of my opinion, but I was in provider relations for a number of years with another carrier, and actually Northern California was my territory. So I used to recruit constantly there, and I know how difficult it is in that area. So that's kind of my opinion about what's going on. Now, everyone will have their own personal issue, okay? They might have consultants that come into the office that say, what are you doing? Stop discounting. Stop taking PPOs or HMO dental plans, and just charge cash, and that's when you have to keep an eye on that, because what happens to you then is you end up going into an office that you think is in network. And after you get treated and you get the bill for the balance, you realize that maybe they have dropped off or something like that. So just always, I would keep checking every time you go in to see your dentist for services that they're still in network.
Thank you, Kara, for sharing
Sure.
your thoughts on that. I know some of these questions can be really difficult, and we're
Yeah.
trying to answer as much as we can. And again, our main purpose here is to understand what the rates are and such, for our members could choose the correct plans for themselves. So we do appreciate our representatives answering these questions as well, and entertaining all the questions as much as we could. The next question is from Mavis. If my son is in college in San Diego, is the Delta Dental and VSP will cover him for college? Does he need to see the dentist in San Diego, or he can still see them in SF? And I guess, Kara, if you can answer this one first, and from VSP,
Sure.
Isabel can answer the next one, please. Thank you.
Okay. I'm sorry, I'm just reading the question again to make sure I
Yeah.
am understanding. Okay. Delta VSP. Okay. Does he need to see that? Okay. Actually, if you are on the DHMO program, which is the Delta Care USA, and your son is in San Diego, which is still in California, you would be able to go to the directory and find an HMO dentist in San Diego for him. If he's on the PPO, he can go anywhere all over the world and get treatment for his dental needs. And then the same thing holds true. Of course, he could see them in San Francisco too. You just have to let us know. If he's on the HMO, just let us know who you are intending to go to see. When you look up in the directory, they have an identifier. Just make sure you send us that identifier through the website, and we'll make sure that they get assigned to that office. So the answer is, yeah, they can see either plan. They can see a dentist all over the state of California for the HMO, and all over the world for the PPO. So.
Thank you. And for VSP, if you can answer the question if it will cover their son for college as well.
Yeah, so with VSP, he can be seen anywhere in the States. We would just suggest you go on VSP.com and then locate a provider, so near San Diego.
Mm-hmm.
Thank you. So VSP.com, and I'm going to drop here the Delta Dental website that we have for SFHSS, which is, that's www.deltadentalins.com /group-sites dash / CCSF. No, that's pretty long, but I think if you go on deltadental.com / group sites CCSF, you find it there. Let's see. Just wanted to let everyone know this is the last 5 minutes before we conclude this webinar. Another question from King. To help me choose in a general term, what is the difference between UHC, United Healthcare, and Delta? It seems to me that from the presentation that United Healthcare has no annual max, while Delta has a 2,500 for PPO. Maybe the other difference is just the network of providers. Could you just summarize what is the strength of each plan? I'm not sure who would best answer this. Sonali, this is probably the best. You'd be the best one to answer this, or what's I don't know if each representative can just
I can answer
say that.
that.
Yeah,
Actually,
thank
I
you.
can answer that. Well, what you're looking at with Delta is you're looking at two separate issues. You're looking at a DHMO plan, which is your HMO basically, and you're looking at a PPO plan to choose from. I think what's happening is you're getting confused because on the HMO plan with Delta, we have no maximum. It works very much the same as the UHC plan does. So if you do Delta Care USA or you do UHC, you're getting the same type of plan with the same co-payments, and your network would probably be different. We may have different doctors on our network for the HMO than UHC has, but that's apples to apples. UHC and Delta Care USA are the same type of plan. Delta Dental PPO is where you have an annual maximum and you pay a percentage of the fees. So take it out of the picture as far as don't even worry about comparing it to UHC or Delta Care USA. Those two belong together as far as the type of plan. And then the PPO is on its own with a maximum and claims filed and all of that.
And with UHC, we don't have a PPO plan. It's only a DHMO plan where there's no out-of-network coverage unless, of course, it's an emergency. It's only in network. But yes, the co-payments are typically similar. And as Carrie said, yes, there could be some dentists that are under Delta that are not under UHC and vice versa.
Yeah, exactly.
Great, thank you both. Does anyone else want to add something there? I think that's pretty much straightforward. Thank you. Not seeing. Oh, let's see. Hold on. I think that it's. Yeah, I'm not seeing any new ones at this point. And again, just want to remind our members that this Friday would be the deadline of submissions of all your plan changes this Friday, October 24th at 5 p.m. So make sure you go on your SF My Hub and submit all your changes. You go all the way through for your changes to be reflected for the next coming year. And again, we have our representatives from VSP, Delta Dental, and UHC, United Healthcare. If you have any inkling questions, you can ask them now before we end this in a minute. Not seeing anything else at this point. And I'm just going to drop our general landing page for our open enrollment website, just in case you need it. Here it is. And again, for any other specific questions for Delta Dental, the phone number is on here. I'm just trying to find it. Customer service for Delta Dental is again 888-335-8227. And at this point, it's 1 p.m. This concludes our webinar. Thank you for joining us today and asking those great questions. And for our representatives, thank you for answering some of the difficult ones. And we hope that you found this webinar informative and that you'll join us. I think we have one more tomorrow for open enrollment. And again, remember to submit your changes before this Friday, October 24th by 5 p.m. And have a wonderful rest of your day, everyone. Thank you so much.
Thank you.
Thank you.
Bye.
Thank you.
Bye.